And good evening and welcome to RFL. I'm Richard French. The number of coronavirus cases and deaths, they continue to go up, and now the debate, it has shifted to when states can open up.
I want to get our economy back opened just as soon as we can, but I want to do so in a safe way.
Every governor in the U.S. wants to reopen, Republican and Democrat alike. That much we can agree on. But when and how, those are obviously the divisive questions. And a lot is riding on it, not just public health, but also the economy and millions of jobs. And for that, plus the president's ongoing battle with, well, the truth, let's bring in senior political correspondent Andrew Whitman. Andrew?
Well, Rich, when to reopen the country is one of those questions that is better left to the experts. So here's Dr. Fauci's answer when asked what the key benchmarks should be before places reopen.
The minimum thing is that you've got to be able to identify, isolate, get out of circulation, and do adequate and appropriate contact tracing as new cases arise.
So the answer is all about testing. That's the key to everything he just said. But antibody tests are still just ramping up, and our testing for the actual virus has been slow from the very beginning. And despite the U.S. testing more people, we still lag far behind a number of other nations when it comes to per capita testing. Spain and Italy, two countries that have been hit hard, still out-test us. So how much testing is enough to reopen? Harvard epidemiologist Richard Hanag says that should depend on the percentage of positive COVID tests that come back. And then places with a 10% positive rate or lower are ones that should begin reopening. The U.S. positive test rate, 18%. Plus, the White House guidelines said states should only reopen after 14 straight days of declines in key stats, something no state can say has happened yet. And yet, these states have either reopened businesses or, like Texas Governor Greg Abbott announced today, will reopen on May 1st. And other states not shown here have begun lifting some restrictions, including beach access. This is causing real fears that all of our reopening might spark a second wave of the virus. Now, that would be bad for public health, obviously. It would hammer the economy again as well, and it would additionally strain the already strained trust between the public and their leaders. And yet, second waves are exactly what we're seeing happening now in Japan, Hong Kong, Singapore, Taiwan, and perhaps in parts of China. So what we're really looking at is, as states decide if, when, and how to reopen, is a political decision largely influenced by public health needs. And politicians, including governors, fear blowback from unpopular decisions like stay-at-home orders. Except the public supports stay-at-home orders and social distancing, and they do so in overwhelming numbers. 86%, that's nearly 9 out of 10 Americans, say they support those measures, and 7 in 10 fear that reopening too fast endangers the public health. They fear that more than they fear reopening too slowly and endangering the long-term economy. Which brings us to the Trump disinfectant briefing on Thursday. Trump at the briefing heard that the virus could be killed in the open with disinfectant or with light, so he asked about medical tests to insert either or both into COVID victims. His experts said that's not happening, and everyone from the experts to Lysol had to remind people not to ingest disinfectants. Trump's press secretary said he was taken out of context. He was not. Trump then claimed he was being sarcastic and testing reporters. He was not. The incident led to another round of disastrous press for the president. Some reports questioned his intellect. Others suggested that Trump wasn't involved with the task force, was staying in the residence late and watching television, and was unprepared for briefings. And a pair of other reports tracked what he said during hours of briefings, noting Trump has congratulated himself about 600 times, exponentially more times than he displayed empathy or made appeals for national unity. And of course, he's never accepted any blame for any consequences of the outbreak. Trump's response: skip the briefing Saturday, skip it on Sunday, take to Twitter instead. In now deleted tweets, Trump attacked the media, especially those who won the Nobel Prize for journalism about Russia. Trump misspelling Nobel and also naming the wrong award for journalism and suggesting the journalists be sued. In another series of now deleted tweets, Trump attacked Fox News, especially Chris Wallace and Fox board member Paul Ryan. Then the White House said no more daily briefings. Then they said the president would take questions at a different event today. Then they announced a 5 p.m. announcement in the Rose Garden that we just played for you, all in an effort to make the president seem less confused. Rich?
So if there's one takeaway, and we're going to get a perspective from Governor Christie Todd Whitman, a Republican, but also very critical of this president and his handling of this crisis nonetheless, it's that we all want to go out. We all want to go back to the way it was. We all are worried about both our personal finances, the country's economic health, and we're just sick of being inside. That much we can all agree on. But Andrew, how much we know after that is about this. We don't know still so much about this virus. I never would have thought we'd be approaching May and not knowing that if you got it once, you could get it twice, that you could actually get a test. Like, we would love to get a test, you and I. There's no way we can get them, right? I mean, we are flying so blind in this, yet I understand the palpable frustration and fears, justifiable ones of the American public, but
from everything that I've read and from everything that I've heard, there's two approaches to handle this in a safe way. One is to keep social distancing in place until everybody has testing, and you significantly ramp up the number of tests so we know who has it, who's already had it, and you can trace where it's moving. But we just don't have the test for that. Despite all the CEOs we just heard from at the White House coming up and talking about their testing, we're nowhere near that level. The other one is reopening businesses in a way that keeps employees safe from customers and customers safe from employees, but also employees from each other. And we've had a lot of meat processing plants that have huge outbreaks in them, pork plants and beef plants. That's because those are so tightly packed with people that there's no way to reopen them and keep social distancing.
And I think it was interesting. Georgia today took the lead on this. You could say recklessly, some would say. But I thought it was interesting. At a lot of the shops that opened, nobody was coming through the doors. Now, that's not universal, but for the most part, your poll that you showed speaks for a lot of America. We all want the same thing, but is it really worth it enough instead of getting takeout to go sit in a restaurant? Is it really worth it enough to get your nails done instead of waiting a period longer? And in small little examples, these are the life choices people have. It's not just about their health. Like you and I say that, when is it safe to go meet our parents? And we won't even know. We do know for a fact that we can carry it and be asymptomatic. So there's so much that's not known, and that's where government comes in. Government has to tell the truth about what we know and don't know. It's not the fault of government, they don't have all the answers, but you can't make stuff up. You can't say that it's a hoax and when it'll disappear and when everyone can get a test, when none of those things are true. And that is what we're going to get into a lot tonight, which is, even if it's not what we want to hear, just tell us the truth so we can believe you when you tell us that there's a solution on the horizon, even a painful one. But without that trust, and right now the numbers, as we'll get into polls that you'll have later on the show will show it, that is in such small supply right now about faith in the president and the federal response. It's complicating an already super difficult problem.
Well, every day, we go through the Cuomo press briefing, we go through the Trump briefing, and then we see other briefings from Governor Hogan in Maryland, from Governor Murphy in New Jersey, from Governor Newsom in California, Governor Abbott in Texas. And the difference, it's not a style difference, it's a spin difference. The governors, for the most part, aren't spinning their press conferences. They're dealing with facts. And they're explaining to people, this is what we know, this is what we don't know. And then you go to the White House and it's all spin. And
there's another thing you mentioned, Andrew. Every one of those governors' press conferences, they talk and they humanize the thousands of Americans we've lost. And that there was somebody's wife, there was somebody's son, there was somebody's brother. Yeah. And the president one time has mentioned a person that was lost, and it happened to be somebody he knew, it happened to be a donor. That's it. And that lack of trying to have a unity to this, whether it be different states, red or blue, but also connective tissue of the American public, has also been part of the challenge. Andrew, thank you. I want to bring in our first guest tonight to discuss former Republican governor of New Jersey, Christie Todd Whitman. Governor, the perfect person to talk to right now, because governors have never been more in both the spotlight and you could even argue the crosshairs of the administration than they are right now. I'll put you in Trenton. You have to navigate, obviously, a cascading economy, but at the same end, seemingly you're dealing with a pandemic with more questions than answers at this point, with no real testing to get your arms around this. What do you do? When do you decide it's safe for your people to go outside?
Well, you can't decide that until you have more testing, until at least you've seen the number of cases drop for 2 weeks, which is the minimum that the administration, when they finally came out with a plan, that's the minimum they required. And you really have to do that because while the states are desperate to get these economies going back, I mean, these are their citizens, the people they serve. And oh, by the way, a lot of the states have balanced budget requirements, which is really putting the pressure on them. But on the other hand, to open up too early and to play around with another go-round of this virus and have the cases suddenly spike again could do more to damage the economy long term. So what you're trying to do is figure out who can safely come back, and with the emphasis being on safety, and do it incrementally. And unfortunately, without a consistent and steady message from Washington, it's much more difficult, because you've got people who are saying, look, everybody, there are people who are opening, people who aren't opening. Why are you keeping me away from work? You're costing me my business, my livelihood, and my life. And the governors get it, and they really want to come back, but they have to do it in a safe way. And that's all they're trying to do.
You mentioned before about the guidelines from the administration. So every day we see here press conferences. You have from both parties governors, whether it's Cuomo and Murphy or Hogan and DeWine. Republican and Democrat governors, I think, doing more than a credible job being transparent with their public. We got a civics lesson where one day the White House said they were in charge of everything. Then it was the jobs of the governors when the Constitution was brought back up about states' rights. But now the president is sending out messages when he sees protesters that they should liberate their states, whether it's Pennsylvania or Michigan. I know it's just a tweet, but they're dangerous messages, aren't they?
Oh, they're extremely dangerous messages, and he's setting it up so that the governors will take all the blame when things don't open the way people want. He's making it very dangerous because people will start to do things that they shouldn't do, exposing others, and maybe even being more violent than that and protesting the fact that they're going to be kept from doing some of the things they want. I mean, this is a serious, serious virus, and the more we learn about it, the more we learn about the long-term impacts, even if you haven't had a very severe case, the more you understand you don't want to get it. No matter what, you don't want to get it. And governors are trying to manage that. And that's why I said at the beginning, you've got to have a consistent message out of Washington. And I just wish the president would step aside and let the scientists run this and tell us what we can expect, what we know, what we don't know, what they think is safe, what's going to be required before you can even begin to think you're safe. But right now, it's haphazard, and it's catch as catch can, and it's squeezing the governors, because he said no, he was going to do it all, that all power rested with him. And then he said no, it's you governors. And then he puts out guidelines that say you can't open until you see at least 2 weeks of a drop in the number of cases. And then he goes out and says, but those people who are protesting, they're right on. They have a right. They should be protesting. And that is it's making it so difficult for governors and mayors. I mean, mayors are trying to do the right thing too.
The one thing that seemed to work was the social distancing, and some states may have done it earlier than others, but it seemed to work. But if I was a governor, the nursing homes will keep me up at night here, because you have the private component of this where they're individually operated. Yes, maybe they're to be monitored and regulated by the state governments, but at the same time, doesn't there almost seem like there's an inevitability, Governor, where that the governors have to step in with some capacity and oversee these, and not just hope that the nursing homes will get their arms around this?
Well, just about every state has a Department of Health. I don't know a state that doesn't. And they're the ones that would monitor the nursing homes, and they should be on top of them. They should be on top. Anytime, any place where whether it's a nursing home, a veterans home, although those are run by the federal government for the most part, anytime you have a concentration of people who can't move, and where people are coming in to see them, whether it be the healthcare workers, or most of them now don't let families in, which is another part of the tragedy, an emotional part of the tragedy, that you've got to be on top of it, because that is, as we've seen in New Jersey, tragically, a number of deaths in one nursing home because people are together and it's easily spread. There's so much we don't know, which is why it is critical for these governors to be able to say to the people, this is what we know, this is what we don't know, but they don't have the capacity to do all the research that the federal government does. And that's where the federal government's got to step up, and the scientists have got to be the ones saying, this is what we know, this is what we don't know, this is what we think can happen. These are your best steps. They've got to help them, along with making sure we're providing the ventilators, making sure that there are enough masks out there. The president has the authority to ensure that. And so far, he hasn't used it to the ultimate of his powers.
And to me, Governor, worse than even a negligence, and even, you know, if you don't show the right fealty in your briefings here, you could run the ire of the president and be even further handicapped in terms of what federal aid you can get. But worse than all that was what I heard from Senator McConnell last week, which was, you know what, maybe some of the states ought to go bankrupt. And the idea that a New York and a New Jersey could go bankrupt and it wouldn't have huge impacts on the national economy. The two of them are two of the biggest 10 economies in the whole world by themselves. But to me, it rang home. I don't know if you heard it the same way, as it's not the United States anymore. It's all of a sudden a political component, who gets help, who doesn't, even with states like your state of New Jersey that gives a lot more in federal funding in terms of taxes than gets back here. I thought it was such a cynical and political thing to say when there shouldn't be red and blue right now in a pandemic.
Well, this administration has been political from the get-go. I mean, both sides have a plate in this game, and both sides bear some responsibility, but it is unconscionable in a crisis like this to play this kind of politics, because he didn't just say they should go bankrupt, and he said we call it the blue state bankruptcy. I mean, he was very clear that this was political. Didn't even try to pretend that it wasn't. You've got real people, real lives at stake here, their livelihood, their ability to support themselves and their children and education. And, you know, it's just, you don't play politics. This is one time, if there ever is a time, which I think is most of the time when you're in public service, you have to stand above politics.
And finally, I don't know what more needs to be said on it, but the number of calls that flooded the poison control hotlines from Americans wondering if they should ingest bleach because the president said so on a Thursday, you know, they couldn't even make a joke about it on Saturday Night Live because it was so bizarre. But that somehow is part of this equation as we're trying to figure out so much of the unknown. Some of the craziest stuff is happening in a 5 o'clock briefing.
Well, that's why I can't watch them anymore, because it drives me nuts, because some of this stuff is just inconceivable. And the problem is just that. As President of the United States, I'm sorry. Now, he's trying to say it was just he was being sarcastic. You don't be sarcastic as President of the United States, especially in the middle of a virus, of this kind of a pandemic. I mean, I learned my lesson early on when I was just merely the president of the Board of Public Utilities in New Jersey, and I made a comment about, I can't remember whether it was oil or gas, and I watched the markets react, and I thought, holy good night. You know, it wasn't a terribly incisive comment that I made, but you learn early on that when you're that kind of a public figure, your words matter. Words shape behavior, and clearly the people who trust Trump, who support Trump, who are always Trump, will go out and try these things. And the hydrochloroquine, I can never pronounce it correctly unless I'm looking at the thing, that he was first touting. You saw that couple who went and they didn't get quite the right thing, but they saw the name there and they took it and the husband died. People will respond to what the president says. You cannot joke in a time like this. You can't be sarcastic. You can't throw off the offhand comments. And that's been part of the problem we've had from the beginning with the president doing these briefings. They mostly are about him. He talks about himself and what a good job he's done and the administration's done. And the scientists are not getting the time they need to educate people the way people need to be educated and given some sense of confidence. And that's what we're missing today. And that's going to lead to a lot of things happening that we don't want to have happen.
And for what it's worth, I think people can see for themselves he wasn't joking during that briefing, which makes it even the more frightening. Governor Whitman, thank you so much for the time as always.
My pleasure. Good to talk to you.
All right, when we come back, we're going to pivot to the presidential race and where we stand about 6 months before Election Day. Joe Biden, he leads Trump in just about every poll, but there is also some bad news for the former VP. After the break, we'll break down the numbers.